Hi, I'm here today with Kenosha County Health Director Cynthia Johnson to talk a little bit about the extreme cold weather that we're having this week and the health risks that come with that. Cindy, what are the health risks posed by temperatures and wind chills well below zero?
Well, thanks for asking, Joe. The health risks that we're most concerned about are hypothermia and frostbite, and these are due to extreme exposure to the cold weather, especially skin that's not covered. Hypothermia is a very severe medical emergency if the body temperature becomes lower than 95 degrees. And so if someone starts slurring their words, they seem to be more lethargic, very sleepy, they're not making sense, and of course they've just been outside. We ask that you would take their temperature, and if it is below 95 degrees, that you would take them to the hospital immediately or call 911. This is a medical emergency. Frostbite is again because the skin is exposed to cold temperatures, and so your nose, ears, if you don't have the skin on your face covered, your fingers, they become very hard, waxy looking, grayish colored, and they do become numb feeling. They might feel warm to the touch or look red in the beginning, burn, but then they become numb and you don't feel that you have frostbite. So watching for these signs and symptoms are very important, but first of all, prevention is the key, and so covering these exposed areas of your skin during this extreme cold weather is really important.
How can people help each other remain safe during the extreme cold snap?
That's a great question, Joe. I would ask that people check on loved ones, especially if you know of any individuals, the elderly, living alone, any neighbors that you know live alone, checking on them. Also be careful with infants that are outside, and remember to bring your pets indoors. Pets should not be left outside. I would say that additional methods of preparedness would be to assure that your car is winterized and that you have half a tank or more full of gas so that your automobile can start if you need to use it. That you also are prepared in regards to your home if your heat would be not working, that you have means to stay warm in your home. And if your heat is not functioning in your home, there are shelters that are available. The hospitals do have warming shelters available, and otherwise there are places on our Facebook page that you can take a look at or call the emergency line and find out where you can go if you would need a place to stay.
Thank you, Cindy.
You're welcome. Thank you.